This week's Ask Dr. Durie comes from a lady who has rather a strange question, actually. She asks, is it possible to have symptoms of myeloma in your head? And the answer to this is possibly yes. And so what in the world does this mean? Well, what it means is that when myeloma is first diagnosed, this is really incredibly frightening, and it's hard to get to the point where one can appreciate that treatment is available, that pains can go away, that anemia can go away, and that someone can really recover and do well and actually get on with their life. And so initially there is this tremendous fear, and what is difficult and very, very important is to make this transition from being fearful to being hopeful. So the transition from fear to hope. And this takes time. It takes successful treatment starting to work, showing that the symptoms are going away. But in the early months, oftentimes if there's an ache or a pain, it does come into a patient's mind. Is this the myeloma that's still hanging around? Is the myeloma coming back? Is the treatment really working? And so this mental aspect should not be underestimated. It just takes time to get that confidence and understanding that treatment can work well, that the treatment is working well, and that those aches and pains can ultimately be disregarded and are just part of everyday aches and pains. Obviously, initially, one has to be sure, and possibly follow-up testing is necessary to be sure that something strange is not going on. But ultimately, as the patient can become more confident, it is possible to have some calmness, that the mind can become calm, just as the myeloma becomes calm with successful treatment and the disease is in a stable state. And so, bottom line, maybe there can be symptoms in your mind, but those go away just as the myeloma moves into remission and the successful treatment takes hold.